Well, you know the saying, spring forward and fall back. When we talk about time change, the clocks will fall back and the amount of sunlight decreases. How might this affect your mental health? Well, we have Baptist Health Psychiatrist Dr. Kristina Kennedy here in studio to explain. Good morning.
Good morning.
Thank you for joining us this morning. So first, how does the time change affect people's health and well-being, particularly, days following the transition?
Yeah, so some people will notice that they get kind of low in the winter primarily, and then once the sun comes back out in the spring, they're feeling just back to their normal selves. So essentially, seasonal affective disorder, which is just a fancy way of saying seasonal depression, is kind of something that we treat within psychiatry for kind of those low feelings that you get in the winter.
And is there a way, people can prevent the symptoms to get ahead of that?
Yeah, so a lot of it has to do with light regulation. And so the decreased light can affect your brain in the way that it affects circadian rhythm and also can affect the neurotransmitter levels that affect your mood regulation. And so one of the biggest things to do to help prevent and even treat seasonal affective disorder is light therapy. So trying to keep the amount of light that you get, like going outside as much as possible to get light during the daytime hours, or then doing a light therapy lamp, which you can buy on Amazon or pretty much anywhere else, and using one of those about 30 minutes a day in the mornings, and starting that now can help actually prevent you from getting those symptoms in the winter or the fall.
Interesting. I've actually seen one of those on social media recently, so I need to look into that. So when do you recommend, reaching out to a psychiatrist if you're feeling this way?
Yeah, so you can try to prevent those symptoms by using a light therapy lamp. But if you don't, and you do start feeling low and it's affecting your day-to-day life or just your, kind of your functioning, then I would talk to a psychiatrist at that time.
Okay, and if someone wants to start treatment, will that be something that has to be continued long-term, or can they do it for just a short time?
So it depends on kind of the patient. So sometimes people will end up staying on antidepressants long-term, or sometimes people will just get on them for the winter, and then when the sun comes back out in the spring, they can get off of them.
Okay. Yeah. All right. Well, thank you so much for joining us this morning, Dr. Kennedy.